Hey everyone, I'm Shehzad. I'm a physical therapist here at Reddy Care. The topic of this video today is one that has it's been in circulation in medical circles for a while, but it's beginning to gain more traction over the past couple of years now. I've actually heard it mentioned twice in some of the classes and courses that I've attended. So I just thought, we'd bring this up because it ties into a lot of what we do, and it's very interesting in terms of the way it affects patient care and physical therapy outcomes. And well, there's two things that tie into each other, one of which is chronic pain. And it's basically the idea being that it's not just mechanical tissue injury that affects how badly your pain levels are or how much pain you feel, but it's the way your brain perceives it. So, I'll give you an example just to demonstrate my point. We're going to take two patients, patient A and patient B, both, let's say, the same age, same physical structure, same level of injury. Let's say lower back pain, for example, because that's just the most generic one in terms of physical therapy. So if you have two patients with an L4, L5, which is in your lower back, both of them with the same level of disc herniation, everything else remaining the same, on day one when a patient A comes in, he says, and I go do the evaluation, and I'm like, how do you feel? And they're like, oh yeah, it's bad, but it's not too bad. I can still move, I can still drive. I'm okay. My pain level, say, is a 7 on 10. Okay, I do the assessment, we start with the treatment. Patient B, on the other hand, when I go in, oh, this is the worst pain you could possibly imagine. No one's ever felt pain like I do. This is crazy. I don't know what to do. I don't know how to move. My pain level's at 20 on 10. And I assess, and it's the same thing, but this individual variance comes into play. And for some, the traditional process of thinking has been that it's just a difference in individual tolerance of how much pain you can take versus how much pain I can take. And while that is still true to some extent, there's also more of a growing body of thought process that says, it's not just how badly your tissue is affected, but all this information, like the brain is the processing center for the body. It's just like the motherboard in a computer, where all the information goes in, and then it is processed, and then it is sent down into your pain cells and to your systemic systems as well. So, for example, if you've had someone who's been in pain previously, or who's had experiences where they had debilitating injuries or injuries which could cause a lot of disruption in their way of life, the brain is going to be more sensitive to the input of pain coming in from, say, like I said, the lower back pain. Which is why you would have someone say, I have a 20 on 10. If someone who's had good experiences, who's had injuries before, but who's actually been able to recover quite well, for their brain, the input coming in might be bad, but because it's had the good experience of recovering from it before, this patient's going to say, you know what? Yeah, it's bad, but it's not so bad, I can move. And tying into that is something that's also been gaining more and more traction within physical medicine, rehabilitation circles, is that it's not just what we do as therapists that will affect the outcome of patient care, but it's also the attitude that patients bring into it. And we see this, I've seen this personally in my practice a lot over the years. And anyone who's got any kind of clinical experience, whether it's an MD, a surgeon, a physical therapist, occupational therapist, across the spectrum of healthcare, is if a patient comes in and they have a positive attitude towards what we're going to do, if they have more of a willingness to work hard and put in the hard yards, as we call it, and they're more compliant with what we tell them to do, if they follow instructions better, obviously the outcomes of what I do are going to be so much better with a patient like that versus someone who just wants to go home and lie and watch on the couch and TV all day. So like, if you are coming in, and I explain this to my patients all the time, is that if you come in, if you're taking the effort, if you're spending time, in some cases if you have a copay or a deductible, if you're spending money to come in here, you might as well put in all the additional steps that are required as well. And I'll go back to a knee replacement as an example. Some patients, say someone who's 3 weeks post-op, A and B again, back to the generic examples. If you have A and B coming in, and A is someone who just wants to be massaged and stretch me a little bit, give me ice and send me home. And don't tell me what to do at home, I'll just do what I want to do. How do you think that person is going to recover versus someone who's going to come in who's willing to be pushed to the limit. And in all honesty, what we do can sometimes, border and really painful. I make sure I don't keep a stick around so people cannot beat me when I'm doing treatment with them. Because sometimes, like I said, it is going to hurt. If this is your knee, if this is how much you can move, and if I keep moving you like this, yeah, you like me more when I do it, but a year down the line, you're going to curse me out because I didn't do anything for you. If I keep pushing you further and further, you won't like me at that point in time. For sure you won't. I wouldn't like you if you were to do this to me either. But this is the only way, pushing you. If you can move your knee to 20, but you need to get it to 110, unless I get the 20 to 25, 30, 35, so on and so forth, what am I doing for you anyway? You might as well stay home and watch TV because I'm not helping you in any way at all. So it's important when you come into physical therapy to have a good positive frame of mind. Now, I'm not saying that everyone should be all cheery and bubbly when you come in. No, when you're in pain, obviously you're not going to be in the best of moods all the time. And I get that. No, I completely get it. But you have to be willing to come in and be a little more cooperative with what I'm trying to tell you to do, or what any of my colleagues are trying to tell you to do for that matter. And also be willing to do the home exercise program at home. If we tell you that there's certain things you must avoid, for example, with a back pain patient, I'm going to tell you don't bend and pick up a heavy box. You're going to pretty much waste everything I just did with you. It's something that you need to be cognizant of and be very careful of. Is you need to have a positive attitude, because it not only will it affect your outcome, but it will also affect the way your brain perceives pain. If you keep telling yourself, I'm in pain, I'm in pain, I'm in pain, even if you may not be in as much pain, you will still feel like you're in pain because you keep telling yourself that. It's very, very, very important for anyone, be it chronic pain, be it acute pain, to be more open in a way, for lack of a better word, to allow your body to heal itself. See, and I say this to my patients all the time, what we do is 40-60. 40% is what I do, 60% is what my patient does. Even if I see you 3 times a week, that's 3 hours out of 168 hours in the week that I'm spending with you. What you do in the other 165 carries a lot of weight as well. If you don't care for yourself the way you should, I don't know how much I can do for you. It's like a patient going to a diabetes specialist saying, oh, I have diabetes. Sure, you're getting your insulin shots, but if you sit and eat a pound of chocolates every day, your blood sugar is still going to go high. So it's important for the outcomes to be good, to have patients who are compliant with what we ask you to do. Because, like I said, I have no problems with people who come in and don't do everything I tell them to do, because really, if you think practically about it, I'm putting in all the effort that I can. But if you don't put in your part of the effort, am I affected? No. Am I feeling bad about the fact that my patient's not doing well? Yes, I am. But it's your leg, it's your back, it's your arm. It's your life that is affected. So anyone who comes into physical therapy, you coming in is half the battle, because a lot of people don't. But if you're only willing to go halfway there, you're losing out. Everything that we do, everything that we have you do, unless it's followed up with the things that you need to do outside of the office, because that's where you live your life. No one lives in the office 24/7. I certainly don't. I know my patients don't. So if you don't want to carry over what I do here into your daily life, the effectiveness of everything we do is reduced by quite a bit. So this is something that I would really have my patients take. It's something I discuss with my patients all the time, especially patients who come in with chronic pain, because acute pain is more easily manageable. Chronic pain has a more debilitating effect on the people, and more often than not, if you've had chronic pain, means you've been around the whole circle. You've seen probably like 3 or 4 MDs in the meantime, had a bunch of X-rays, MRIs, what else have you, seen probably 2 or 3 more people, and then you come to me. So by the time you come to me, you're half jaded anyway. So it's a lot of information that has to be processed when a patient has chronic pain. So by the time, and going back to the brain we were talking about earlier, it is also the brain that by then is tired. A lot of patients are frustrated because they've been told 5 different things by 10 different people, and they're confused, and that doesn't help, because the MRI said this, but my neurologist said this, but the orthopedist said this, and now you're saying this. So who the hell is lying to me? Who's being honest with me? And I get it, it's frustrating. Anyone who's been dealing with chronic pain is frustrated. And very often letting that frustration out is half the battle won, as far as I can see, because that, just processing all of that and trying to simplify it and saying this is what it is, this is what we're doing, this is what we need to do, that can definitely have a big effect. So if chronic pain is something you've been dealing with, if you're confused, you're frustrated, don't be worried, because you have plenty of company. Unfortunately, I wish it did not exist, but given the nature of the human body, it is something that does exist. It's probably going to get more and more attention as the population lives longer, chronic diseases become more prevalent. These are issues that may not have been as deeply looked at even 40, 45, 50 years back, because life expectancy over the last half century has gone up quite significantly. And like I said, chronic pain is something we deal with all the time in the office. And if it's something that you have been dealing with, if it's something you want to have addressed, you can give us a call at 516-829-0030 or come see us at 475 Northern Boulevard. Take care.